It'll be available on our website afterwards, and we'll also send all registrants a link so that they can review the webinar itself and share it with all your friends and family as well. Let's see. We're hosting a second webinar on Thursday. That's also at 12:30. We'll have with us then a panel of center administrators who are going to be talking about how they've put some of the rules and regulations and recommendations that we're talking about today, how they've put those into use. So if you haven't registered for that, keep that in mind. The registration link for that is in the very same email that the registration link for this webinar was in. So you can look back at that. I'll put that in the chat as well so you can find that too. Let's see. All right, next I'd like to introduce you to Melinda. Melinda is a technical assistant for Step Up to Quality here at Action for Children. She works with both center-based providers and home-based providers. She's been at Action for Children for about 8 years. And before that, she was a teacher in Mexico, and she's in a bilingual school and has had a couple other really unique and interesting roles in our community before joining Action for Children. So we're really grateful to have her today. She's going to be moderating our conversation and asking the questions that so many of you submitted in advance of our webinar today. And I'll let her introduce Suzanne.
Hi, good morning, everyone. I am lucky to be talking with Suzanne this morning. I'm sure a lot of you recognize her face. She's been working at ODJFS for almost 20 years, she said. That's kind of amazing. And she currently is the supervisor, but before that she was a specialist. So she knows all the good information inside and out, I'm sure. And she said, whatever, if you come up with something that she can't answer right off the bat, we'll look it up for you and get back to you with any of those answers. She also has experience working in Head Start and as a center director. And before that, like a lot of us, started off being a teacher. So I feel like she has lots of good experience and lots of good information for us. So welcome, Suzanne. Thanks for being with us today.
Thank you. Thank you for having me. I just want to start, before the questions start, saying how happy I am to be here. And I don't see your faces, but I see a lot of your names on my screen, and I'm really happy and pleased to be reaching out to you. I miss you. I miss being out in your centers. I miss administrator training, and I can't wait till the day that we can kind of transition back into that. I know that you're all going through a very hard journey to get where we are today, and we've got a little bit more of the journey to go. So I will answer as many questions as I can to the very best of my ability. We are kind of in the position at ODJFS where things are happening almost day to day. So the things I tell you today could very well change tomorrow. So just continue to be flexible and reach out to your licensing specialists if you have questions, because they are ready and willing and eager to answer your questions. And they're excited to get out and start seeing you guys out in your programs soon. So with that being said, Melinda, I think we can get started.
Okay, well, we're just going to dive right in. You guys submitted lots of really interesting questions, so we're going to see how many we can get through. So I think one of the obvious questions that was not a surprise, but it's one of the things that we struggle with most, is the group size and ratio under the new rules. Is there any kind of indication about a tentative timeline for raising those ratios? Or is there any kind of insight about how they chose those numbers?
So what I'll start by saying is I'm trying to get my screen up here. The rules that we are going by today, it's 5101 2-12 2.02 are the transition pandemic rules, is what we're calling them. Those are in addition to 2-12, which we'll be following for all the other rules. So the 2.02 rules are specifically for this transitional pandemic care. And those rules were written according to specifically the governor's executive order that he has put out. And they will stay that way until he rescinds that order. He is working with ODJFS and the health department and other industry or other entities in early childhood in this decision-making process. So he's not making the decisions in a box. He's definitely getting expert opinion. My theory is he'll see if there's any kind of spike in numbers. His main concern is keeping children and families and our staff and childcare safe. So we will follow these ratios until we hear otherwise.
Absolutely. Okay. Just kind of as you're contemplating going back to doing kind of more normal licensing visits, do you anticipate those visits looking differently, or is there something they need to do specially to get ready for those visits?
The visits will look, they will look the same and they will look different all at the same time. So the expectation is that the rule requirements are in place and that you'll follow them, with the addition of the new rules that we'll kind of talk about during this Q&A. Our regular inspections will begin after July 1st, because that's when the new fiscal year starts. So you'll start to see your specialists show up on your doorstep beginning July 1st. At the current time, before July 1st, we are working on provisional inspections. So if you're a brand new center in your first year, we're catching up on those visits that we weren't able to do since March. And then also any complaint investigations. So you may see your specialist before July 1st. Any TA visits that we're doing, we will have to do by phone. So we are utilizing things like Skype and Zoom and Microsoft Teams so that we can do that a little more effectively using FaceTiming and cameras and things like that, or just by phone if that's what you prefer. Our licensing specialists are following their own safety protocols. So just like you have your protocols in place, our specialists are as well. So you might see them, they'll come in with their masks, they'll have their hand sanitizer with them, they're gonna wash their hands frequently. You'll take their temperature as they walk in the building as well. And then trying to limit exposure and close interactions as much as possible. So they'll be following some of those safe distances as well. So that might look a little different to you. It might feel a little distant because physically we will be distant, but their goal is still the same. They'll conduct their inspection and then they'll give you TA or any help that you need along the way.
Great. Yeah, that sounds really good. Someone asked, is there going to be a grace period for having updated forms as kids were out of the center and now they're coming back in, or you might have new kids that are coming in? Is there any kind of
So let me back up just a little bit. So if you haven't already, there is this amazing toolkit on the JFS childcare website, and
oh, perfect. Kat just put it in the chat.
Yep, as they say, it's going to go in the chat, and I just learned how to do this. I think screen share it with you. Maybe. All this technology is new to me, so bear with me.
We're almost there. I see it on the screen.
Can you see it? Okay.
There it goes.
All right. So this is, if you follow the link that was in the chat, it's jfs.ohio.gov /CDC, coronavirus, and childcare. It'll take you right here, and then you won't have to walk through the whole, if you put the coronavirus and childcare in, it'll take you right to this screen. And if you notice, the first thing that you'll see is the rules. And the very first line under the rules is the manual transmittal letter. That's a really important document. That's a document that came out with the rules, and it provides some further explanation. So the rules are pretty cut and dry. You must do this, you must do this, you must do this. The transmittal letter is going to give some more guidance on how to do that. So definitely when you hear me refer to, it's called an MTL 25, that's what I'm referring to. And you can have access to it right there. And then the next line is the actual 2.02 rule package. And so you'll want to pull that up, keep it on your desktop, print it out, whatever's easiest for you. And then if we have any family child care providers, I should have asked in the beginning if we did, but if we do, their rules are here, as well as the day camp rules and the PFCC rules and in-home aid rules. So any package that fits you, that's where you will go to get that.
Great.
Yep, and then the next thing is the grant opportunities, which we'll touch on briefly at the end. The next thing is technical assistance documents, and we're going to refer to those quite a bit during the Q&A here today. It's got all kinds of sample forms and TA documents and guidance documents and links. The next document is the Responsible Restart Ohio. So that came out actually prior to the rules, so it kind of got centers set up and ready to get started even before the rules came out. And we will refer to that. That was written by the Ohio Department of Health. And let's see, there is also a training that was developed. And if you haven't taken this training, it is linked right here. We've got the child care centers and the day camp one, and then the family child care one. I would absolutely recommend that you take that training. I took it. It's very helpful. It gives a lot of suggestions and guidance as you're reopening your programs. Great. The next training is a really great one. It was provided by our health consultants, and it speaks specifically to your mental health, your children's mental health, and all of our mental health as we're going through COVID. And it is also an excellent training. You can link to it from here. And then the last section is a little more general. There's another webinar called Adapting, Evolving, and Thriving that you can take a look at as you're reopening your program and getting strategies on how to reopen while you're following these new rules and following these new safety protocols. And then there's just a lot of really good information and posters and handouts from the CDC. We really do utilize the health department and the CDC's knowledge and expertise quite a bit when we are creating our rules and our technical assistance. So that is, yeah, that is in a nutshell the toolkit. So I would highly recommend that you bookmark that and keep it available. I'm going to try to figure out how to get back to my regular screen so I can finish answering your questions. Stop share. Okay. Oh, is it still up or are you guys good?
Oh, I can see the regular screen now.
Okay, perfect. Okay. Next question, Melinda, if you don't mind.
Yes. Do you think there is a possibility for another mandated closure coming?
Well, if I had a crystal ball,
right,
I could answer that question, but I do not. So my thinking is as long as cases of COVID and numbers decrease, we should be in good shape. So that is the unknown.
Right. Hopefully not, but
hopefully
we'll see,
not.
right?
Right. We will wait and see. The goal is to keep everybody safe and healthy. I did want to go back because I didn't quite finish answering your last question about the inspections. I apologize.
That's
My brain got a little little scattered there. If you do look in MTL 25 that we just saw on the last screen, it gives a list of 1, 2, 3, 4, 5, 6, about 10 things that we, as specialists, as regulators, are going to put off assessing until November 29th of 2020. And some of the things on the list that you mentioned were child medicals, staff medicals also, because we recognize that there might be some issues getting into doctors in the short term. Expired credentials, so if your CDA expires, we're working with the council to make sure that you can move forward on those, but we're not assessing any expired ones at the moment. Annual fire inspections. If you can get a fire inspection, obviously, if your fire inspector can make it out to your building, absolutely do that, because we do want you to still be safe. But if they are backed up and they can't come out and your specialist shows up and your fire inspector hasn't been out yet, we will not assess that until November 29th. So there's a list of things you can go in that MTL 25 and take a look at the rest of them. But we have been very cognizant of items that it might not be easy to assess or easy for you all to get. And then the very last thing is July 1st of 2021. So now we're looking a year ahead of time. That is when we'll start assessing professional development again. So the 6 hours that you need, we recommend that you still get it. There are tons and tons of great PD online if you're nervous about going out or if you can't go out into a group setting, but we won't be assessing it until a year from now. So,
can I just ask, is that for licensing and step up hours?
This is just for licensing.
Just for licensing
hours.
Okay.
Step
July
up, we
1st.
have a whole, step up, we have a whole other year in our biennium. So you'll be able to take them then.
Got it. Very good. So of course the idea is if you can get those things updated, do them as soon as possible, but you're not going to get basically kind of dinged for it until November, right?
Exactly. You got it.
Perfect. Great. That sounds great. So let's move on. We have some pretty specific questions about sanitation. Okay. So what does sanitized toys after each use mean? Does that mean each group, each child, each day?
It could mean all of those things. So we do ask that you follow your regular cleaning guidelines that are set up in 5101 2-12 Rule 13. So we ask that you still follow those. That means using a chemical product that is registered by the EPA, using your bleach water solution if that's what you choose to use to clean. Follow the manufacturer guidelines. If it says spray and leave, make sure you're doing all of that still. Then we talk about best practices, and the best practices aren't something that we are going to monitor or assess necessarily, but you'll want to make yourself familiar with cdc.gov, which is a great website that has everything you need to know about COVID and childcare and how to clean and what the best ways of cleaning are. In our mind, we're thinking cleaning should really be after each child. So if a child uses the restroom, it should be sprayed down after the child uses it. If a child is working on a science project at the table, clean that child's stuff up, spray down the table and chair, and then bring the next child on. So we really think of it as after each child, but there are going to be times like at the end of the day, you'll want to, clean everything and get it ready for the next morning. So that would be for the whole group. So do the best that you can. If you have any questions about your cleaning practices, just go ahead and reach out to your licensing specialist and they can give you some guidance on that. But the CDC is the very best way. They do a lot of webinar trainings that you can take that kind of walk you through this, what does it look like to sanitize?
Sure. Do you have any specific maybe tips or things that you've heard about cleaning the playground. Specifically, somebody asked about UV wands, which I didn't even know existed.
Yeah, that was new to me too. I looked it up, I Googled it. It does say it kills 99.9% of the germs and all of that. So that would be, we don't have a rule that would limit you from using that on the playground. So if that is something that you have, I wouldn't necessarily say you need to go out and purchase it, but if you have one, absolutely. What I did read on the CDC guidelines was specifically to playgrounds. It talked about it's not necessary to clean all the surfaces of your playground. That would be not a really good use of your chemicals, of your resources. But definitely think about wiping down the handrails and those places that are touched a lot. But we don't have a rule that talks about sanitizing your playground at all. So you would just follow guidelines for that.
Perfect. There was another kind of specific question about sensory tables, things with water or, other things where the kids might have their hands in the same table or the same bucket.
Yeah, I think even on a good day, it gets kind of icky, but sensory is so important, and we know that. So what the CDC recommends, and I think y'all are going to talk about it a little bit in more detail at tomorrow's webinar, but really thinking about taking that large sensory table that we're so used to having 2 or 4 children around at the same time, and really breaking them down into some smaller containers, either individual, if it's got things like sand or beans or whatever in it, breaking that down into individual containers. If it's water, you could simply use a smaller container, dump it out, sanitize it, and then fill it back up with water for the next child. And you could use those, Rubbermaid tubs or something like that. And I think I see
We're
behind
showing
my screen
a picture here.
Yes. So this would be an example of some more individualized kinds of things.
Mm-hmm.
Of course, you'd always want to remember to have the children wash their hands before they enter that little play space and then when they're done. So be diligent about that as well.
And I think along with that, somebody had asked, is it okay to put a little bleach in the water? I don't know about kids sticking their hands in bleach.
Yeah, I would stay away from the bleach. I think to make it even effective, I think you have to use 5 tablespoons per gallon. So that would be an awful lot of bleach that you're putting into a space that children are playing. So I would stay away from that. I think the more logical thing to do would be use smaller tubs and then sanitize it, wipe it down,
Sure.
and sanitize it after each use.
Okay, very good. Okay, so now we're kind of moving into an area of, we had lots of questions about what's a recommendation versus what's a requirement or a rule. So there might be some follow-up questions about some of this stuff too.
Sure.
This one is, will programs be expected to employ all recommended best practices, or are these just suggestions?
So the answer to that is recommendations are just that. They are suggestions. They are best practices. They are good ideas. They are not necessarily something that we will assess. We are assessing only what is in 5101 2-12 and then the new rules 2.02. So we will be assessing those things. The recommendations you're going to find in the Responsible Restart Ohio, which you can get on in our toolkit. And then there's a very nice TA document, and it's called Transitional Pandemic Requirements and Best Practices for Licensed Child Care Centers. So it would take, it takes the 4, I think, new rules about temperature taking and drop off and pick up, hand washing. It takes those rules and it breaks it down into ways that you can meet that rule requirement. Then it gives best practices and some helpful tips. So you could pull that up and take a look at that as well. So recommendations are just that. They are suggestions by experts in the field. we suggest you follow them as much as possible. We know that there's going to be some barriers and maybe some business practices that will not allow you to follow the recommendations, and that's fine. But do as, follow them as best that you can.
Okay. Looks like we had a little follow-up question in the chat about sandboxes. How do you sanitize sand?
Yeah, so
we could have them in individual containers, right?
Yeah, so I think indoors you can absolutely have individual containers. I've even seen where, if you've got a group of 6, each child has like a shoebox size container, maybe a little larger, and has their name on it. You could absolutely do that indoors. If the question was for outdoors, I would recommend not using that, just keeping it.
Because how do you clean it? Right?
Exactly. Yeah.
Okay. All right, let's see what we have next here. This is kind of going back to a little bit about ratios. If a group of children are assigned to one particular adult, how can that teacher take a break or bathroom break or lunch or have a day off? What's the suggestion for that?
Yes. Well, the good news is you can all still have lunch breaks and you can all still take time off. So that's the good news. In the Responsible Restart Ohio document, the recommendation was that staff should remain with their group throughout the day. But of course, when staff are out or take breaks, another staff person can absolutely go into the room to fill in for them. Just practice diligent hand washing as that staff member enters and leaves the group. If it could be the same person going into the same group throughout the day, that would be helpful too. But of course, we know that there's going to be other staff entering and exiting the rooms. You just want to make sure you're doing it safely.
Mm-hmm. Do you, I think it's one of the questions here, but do you recommend that there be a certain person who's the break person, like a floater, or try to avoid that? Like the same person going in to give each person their break so that they might go to every classroom throughout the day, or try to avoid that?
I would say try to avoid it, but pragmatically, how can you avoid it?
Right.
So that's why it's important to do all of that hand washing as that floater enters and leaves the classrooms, just really making sure that they're, washing their hands and doing all of that preventative stuff. But there are programs that are utilizing floaters. They're helping get children from the car. If they're doing an outside drop off, they're taking the children from the cars to the classrooms. Right. They're breaking at lunch and taking them back out to the cars at the end of the day. So they've got kind of a designated person doing that.
Great. Okay. I was going to ask this next, but it also popped up in the chat. So when the ratio says 9 children to 1 adult, could it be 9 children and 2 adults? Like if there's more than 1 adult, is it a total of 10 people, 10 bodies in the classroom, or?
There can be a second adult in there. That is fine. I know that a lot of programs wanted to have lower ratios. That is fine. It can occur in the toddler room as well. You can have 2 teachers with those 6 children if you so choose. Okay. Again, the goal is to limit exposure, but if it's the same 2 teachers every day and they're doing all of their preventative kinds of things and they're washing their hands and doing all of that, that is permissible.
Great. Speaking of dividing classrooms, if we've taken a classroom and kind of divided it in half and put some kind of a barrier between, but now there's no access to the bathroom, if we have to take the children from the non-bathroom half to the bathroom half of the classroom, is there a recommendation for how to do that so we're not mixing the groups? I'm thinking especially of potty training kiddos, like you can't really make them stand quietly in line and not touch anything.
Of course. Well, as much as you can, you'll want to take children to the restroom one at a time so that you don't have those groups of children waiting. So that's where your floater might come in handy again, that second person in the classroom. But yes, the children can pass through one of the divided spaces to get to a restroom. That's perfectly allowable. Now,
Okay.
they don't want to stay and linger and mingle and do all of that,
Right.
just get to the restroom, do your business, and come back. And then that floater person could even go back to the restroom, spray it down, and get it ready for the next child.
Okay, great. It looks like we have in the chat, are we able to have teachers alternate? If you divide a large group into two, have the teachers alternate weekly so they can get to know both groups of children?
We don't have anything that prohibits that, so it would be okay. You'll just want to think about limiting exposure. So it is possible that you could do that.
Okay.
I don't know if it would be a recommendation to do it, but I understand the idea behind it.
Sure.
When we're talking about step up, which
Yeah, we're gonna get to that in a couple minutes.
yeah,
Yeah.
but when we're talking about step up, I believe the instructional time still has to occur in each of your divided groups. So it is possible that you're going to have a teacher that each day goes into the other part of their divided room.
Okay.
So that's, if you're step up to quality, that's already going to be happening. So having them switch weekly, I don't think is a huge, bad idea. Just do it safely. Yep.
So the bottom line is the least people we can have, like the less times you can switch out teachers or alternate rooms or what, like the more you can stay in the same room with the same group, the better.
That's the goal.
Okay.
We know there's going to be times where it's not possible to do that, but the goal is as much as you can.
Okay.
Okay.
There was a kind of a funny point in the rules that I had a question about. It says that children should be grouped by the parent's employer. I don't know if that was just during the pandemic time, or is that something to be considering when you're making group?
So it's a recommendation. If you decide to group children in different ways, you can group them by the employer. You can group them by the same family. What you're trying to do is get the same exposure germs together. It's certainly not a requirement to do so, but it's a recommendation. We had some providers ask during the pandemic where essential staff children were being cared for, and they were asking, can we keep them in the same groups by their parents' employers or by their families because they're getting exposed to the same germs. So it just carried over.
Great. So let's move on to kind of drop off and pick up. Can parents drop off their children outside?
Parents can drop off their children outside to a staff member. So if a staff member is standing outside to greet those children and kind of transition them through the temperature taking station and the hand washing and all of that, and then get them to their classrooms, that is perfectly okay. And in the Responsible Restart Ohio, there's a very nice section about drop-offs and pickups that kind of talks about what that should look like or what that could look like. But yes, that's perfectly acceptable.
So again, we're just going for the least exposure possible.
Least exposure.
Parents wandering through the hallway if we can avoid it.
And really having communication and conversations with your families. If you're a part-time preschool and everybody drops off at 9 a.m. and it gets too crazy, you can talk to parents about staggering drop-off and pickup times. Or requiring the parents to wear a mask and drop them off in the lobby, or there's lots of different ways that safety kind of precautionary measures can look like.
Okay. There was a question about, will there be any direction on how many children can be transported on a bus or a van or whatever to school at one time? I know the recommendation now is not really to do much transportation, right?
Yeah, that is the recommendation. There is a document in the toolkit called Transportation Best Practices, and it kind of outlines field trips and routine trips. And it just talks about field trips are highly discouraged, but we know that programs really want to start getting back out there and doing things with their children, even if it's to a park or something like that. They're discouraged, but they're not banned. So if you do choose to do field trips, and then in the fall, especially routine trips, that is okay. You just have to follow all the guidelines of the rule. And then there's these best practices. So while you have to maintain the ratio on the vehicle, there's nothing that says you have to make the group sizes smaller. So if you're taking a larger group, just think about how you can distance them as they're being seated on the buses and things like that. And then, sanitizing the seats when they get off and all of that. So they're not prohibited. They're just, you want to really think about the safety aspects as you're taking these trips.
Great.
And that document is a really helpful tool. So I would highly encourage you to pull that up before you take your trips.
Great. How about, let's talk about meal times for a second.
Okay.
Are we no longer doing family style, or are there any specific recommendations about how to do meals more carefully?
So it is recommended that family style meals be ceased at this time, and the meals be served by the staff member. It's recommended the staff person wearing gloves and probably even a mask, so that you're not maybe coughing or sneezing into the food, or but definitely family style meals should not happen at this time. There is a really good resource. Let me scroll back up and find it. The National Head Start Association has a ton of resources, not just for Head Start programs, but for all early childhood programs. They have federal and state guidelines, guidance from the medical community, program management. So if you're having a hard time figuring out how to manage all of this, there's some really good documents. And they did a lot of webinars during the pandemic that they taped, recorded, and you can take a look at those. They have a section specifically on food and nutrition services, and then other kind of general resources. So, and like I said, it's for all programs, not just Head Start. So if you're specifically thinking about how to do meal service, that's a really good resource. NACI also has a ton of resources specifically for childcare programs, coping with this new world. So that's another good resource too. They did a lot of webinars that I personally took during the pandemic and got a lot of really good resources from it.
Great. I think we'll try to add some of those links to the webinar when we share it, so people can find all these things that we're talking about, the great tips.
Great.
Let me just see, in the chat there was a question about, can we put 1 2.5-year-old in a 3-year-old class and maintain a 1:9 ratio?
You can have one child of the lower age group, just like in the regular rules.
Okay, very good. And let's see what we're going to move to next. I think we'll hit some equipment and materials questions. Probably a lot of these are covered in the toolkit also, but what should be done with infant teething temperatures? So as we're taking temperatures as the kids are coming in, a lot of times infants have those mild fevers when they're teething. Is there a recommendation for that?
This was a tough one, and I had to reach out for some answers to this one because the rule is very, very specific. It says a child must go home with a fever of 100. It doesn't say unless they're teething. It doesn't say you be the judge. It really does say 100-degree temperature, and they have to be fever free. So I wouldn't want to make that decision. Hey, this child's teething, they're fine, and have that be the wrong diagnosis. So so children really do need to go home, and you can explain to parents that it is a safety measure. Also in the toolkit, when I was talking about it before, there's a really great sample letter that you can send to your families that talk about all the different precautions that you're taking and how you're going to keep their children safe. And that might be a good thing to give out to your parents so that they know things are going to look a little different, going to be a little more strict about things. There's going to be things happening that they're not used to. This letter will help kind of explain that.
Perfect. It's come up several times about children wearing masks. I've heard under 2 years old, they shouldn't be wearing a mask, but anybody else? Is it optional?
So under 2.5, not wearing masks is a CDC guideline, Center for Disease Control guideline. So that is not in the rules. The rules are silent on PPE, on masks and gloves and whatnot. So that's really going to be a program decision. If you feel like for the safety of your families that the children need to wear masks or the staff need to wear masks, that is really up to you all. It's a good idea, at least for the staff to wear them, but it's not a rule requirement. So I would definitely look up PPE in the cdc.org and just kind of get an idea of what they say about it and decide if you're going to take their recommendations or not.
Okay. So follow up here, is there no rule about staff wearing masks? That's just a recommendation.
Just a recommendation.
Okay. I would say, especially when you're dropping off, picking up, having contact with outside people, for sure, right?
I would say for sure, when you're doing that initial temperature check, if you've got in your lobby area, you've got your temperature table set up, I would definitely do it out there. The governor did require, I believe, businesses, employees of businesses to wear masks. And where it gets a little confusing is, because that would be us, right? But where it gets a little confusing is the child care centers are exempt from that. So again, it's a program decision whether they want to wear masks or not for their staff.
Okay. Again, kind of a specific follow-up. If families choose to carpool, is it possible to have 3 different families' children arrive at one time? Should we say no to carpooling or handle them as if they're siblings?
I have not heard this question before.
That's a new one.
Yeah, so I guess
I think if you have a group arriving at the same time, it would be the same, right? I mean,
I think you're still doing the hand washing and the temperature checks when they get there. So what they do prior to that really can't be it's not really our business. I mean, if they had a sleepover the night before, we wouldn't really know that. So just make sure your safety precautions when they get into the center stay pretty rigid, and that they should be fine.
Okay. There's a question about why are no-touch thermometers allowed during this time, yet the auxiliary or armpit method must be used during non-pandemic time?
Yeah, that was a really interesting question too, because I hadn't really thought about it. So you reached out, and basically the thermometer requirement that we use in our current rules, not the pandemic rules, is created by the health department, and that is a requirement that they kind of instituted. I don't know if it could be changed in the future. It's certainly worth having a conversation about. I'm not sure we really thought about it too much until this pandemic, that there were other ways to take temperatures. So that's definitely something that we will take into consideration as we're looking at when we're revising the rules. I would say when that rule package opens up, you can definitely make that suggestion, and we'll take it into consideration. But for now, you can absolutely use the no touch. You can use the digital under the armpit. Both of those are fine.
Okay. Let's see, I'm just kind of scanning here. Any thoughts about what the state will be recommending in regards to families who travel or have a frequent traveler in their household?
So my suggestion for that would be to reach out to the health department for their guidelines on that. I know that they do have pretty strict guidelines about those folks quarantining, but I don't know to what extent they would recommend everybody in the house quarantine or just the traveler. So definitely reach out to the health department for that.
Is it okay for a center to say to parents, we would rather have a certain person dropping off the kids and picking up? I know it's not a rule, but could it be a good recommendation or part of a family information letter or something that if as much as possible, if they can have the same person picking up and dropping off?
Yeah.
Again, to limit that exposure.
Yeah, I think if the center is instituting some extra safety precautions and it becomes your policy during this, it's absolutely okay. You do just want to be, like you said, Melinda, upfront with the parents, let them know, maybe put it in that safety letter. But yeah, definitely, you can make policies above and beyond what our minimum standards are.
Great. I want to change gears just a minute to Step Up. We just had a couple questions about, you already kind of talked about deadlines and there's already Step Up visits going to be happening soon. Is that the same July 1 deadline? They're going to get started again, or?
We are already doing Step Up visits.
For people that had already applied?
For people that had applied before the pandemic. So we're trying to finish those up because we kind of stopped midstream. And then the 1-star visits are actually, we have a policy or procedure that we are using where the 1-star verification visits will be an extended desk review. So they'll actually be done electronically or over the phone communication. So that will limit our exposure going out to your programs. 2s, 3s, 4s, and 5s take a little bit more, and so we will be going out for those. And those have already been done. We might look at some different ways to do interviewing at 3, 4, and 5. Maybe some tele-interviewing like we're doing now, phone calls, things like that, to again limit the exposure and the time, length of time that our staff are out at programs. We're limiting how many of our staff visit a program at one time. So if you're a large program and you're used to seeing 2 or 3 specialists come for your Step Up visit, it might just be 1, maybe 2. Okay. So that's going to look a little bit different. It might take a little bit longer if there's only 1 person doing the inspection, doing the verification visit. But we're working through all of those kinds of things.
Are there any expectations about, again, the updated paperwork, like if kids have been out and now they're just re-enrolling? Does it go back to the within 60 days rule? Do we consider them re-enrolled if they were, you know what I'm saying?
I do know what you're saying. And it's really up to how you as a program are documenting that. I would say if center's closed and you considered everybody unenrolled and then you re-enrolled them, then they're new and they would have a new enrollment date. If children kept coming during the pandemic or you kept them enrolled, then we would look at the paperwork that was occurring prior to the closure. So when did everybody close? March 26th. So we would look at it prior to that. Because if you submitted your registration, then that was telling us we've already done assessments on these children. We've already planned and had a a parent meeting, and so we would look at that documentation.
Great, that makes a lot of sense.
Of what was happening before.
Yeah. So if somebody's new, oh, sorry, go ahead.
No, you go ahead.
I was going to say, if somebody's doing a new application for a 3, 4, or 5, where you have to have those assessments and observations, like they should wait to apply until they have that stuff in place if it's a new application, right?
Correct. Yes. Okay. Or they could apply at a lower rating where they're meeting all the standards and then work their way up as they're getting more used to this transition and what's happening. That's definitely an option too.
Do you have anything in particular you're looking for Step Up? Any tips or anything you want to add about Step Up visits?
Not any more than I already did. We'll continue to work with programs, but the expectations are pretty clear for Step Up. So if you feel like you can't achieve that higher rating at the moment, definitely we'll work with you for those lower ratings where you're meeting those standards, and then we'll help, you can work up a little bit later. But we'll work with you and help you through that.
Great. I just wanted to say out loud, just in case everybody wasn't aware, that all the deadlines got moved forward 6 months. I think a lot of people are, oh, I just reopened and now I have to do my renewal, or I have to, I'm a 2 and I have to move up to a 3. But all of those dates have been pushed forward. So everybody needs to check their OCLQS for their updated due dates, right?
Correct. And then the July, everybody in the state of Ohio has to be rated by July 1st, got pushed to September 1st. So You've got the summer to kind of, if you've never been rated before or you're not currently rated, you have till September 1st. So in the very bottom section of the toolkit, there's a whole section about communication, and it's all the letters that have gone out from ODJFS, and that includes the letters about the Step Up dates shifting.
Okay.
Take a look at that.
In the chat, we have a question about leads versus assistants. When needing only leads, it changes our staffing. Step-up requirements were met when a lead and an assistant were in the same room, but now they have to be each with their smaller group. So that doesn't meet step-up guidelines. So is that what you were talking about earlier, about maybe having the teacher rotate between the 2 groups?
Yes.
The teacher, sorry.
Yes, because they do have to meet the instructional time just like they did before the pandemic. So yes, I'm scrolling. Let me find that. I made some notes here. Oh, maybe not. Okay, so we're really looking at a lot of things with Step Up with these room dividers. We recognize you used to be 1 classroom, and now you might be 4 different preschool rooms. And so we're trying to figure out, how do we OCOT that? How do we come up with how many staff we're going to interview? And so we're really looking at what your program was before. So if you were 1 preschool classroom, then we're going to interview that lead teacher, and we're going to expect that preschool room to have a lead teacher. And then we're going to expect that preschool teacher to be able to do the instructional time in the smaller groups. And the reason that we're doing that is because the instructional time, that's really a federal guideline that this instruction time has to happen. And so we weren't able to make any adjustments to it. So we were like, well, how's that going to happen? So it may be, you might need 2 lead teachers for your new set of classrooms, because 1 teacher's not going to be able to do instructional time for 4 classrooms. So you really want to look at that. And how you're dividing your rooms and what that's going to look like and what your staffing looks like. And it's possible if you don't have enough staff, maybe for the higher ratings, like I said before, during this pandemic time, we can look at some of the lower ratings that you're meeting with your staffing and then move you up once these extra requirements start to kind of drop off.
Okay. Just a clarification real quick. Somebody said, is Step Up required just for centers that accept PFCC?
That is correct.
Right. Okay. And another quick one, can a floater take children to the bathroom from every class in the center? We have 3 classrooms, so a small center. Yeah,
so we kind of talked about that before. That might be the only way that you can operate under these new conditions,
right?
Because you've divided up your rooms, and the children don't have that immediate access to the restrooms. So I'll say just one more time, maybe 2 more times. Following those safety protocols, and before she's going from one group to the next, she's doing all of that hand washing and really sanitizing herself before she goes into that next room.
Sure. Do you have any opinions about face masks versus face shields? Someone asked. Should staff be wearing face shields?
I have no opinion about that. I don't know enough about face shields. I feel like that might be way extra. So if you feel like for your safety, that's a better route to go, I think you can do that. But I feel like the face masks would be sufficient and a little less intrusive and cumbersome. But that's really going to be a business choice. And you could, again, go on the CDC website and see what are the pros and cons of each and what best meets your needs.
Great. So I see that we're running a little bit short on time, so I want to make sure I get to, if there is an instance of a confirmed case, whether it be from a family or a staff member, is there a set of policies from ODJFS about what to do when that happens?
There is, and this is pretty important. So in the toolkit that we just talked about, there are two documents. Let me find it. There's one called Positive COVID Test and Pandemic Day Guidance. That's a really important one because that gives step-by-step how to report a positive test. So if you send a child home with a fever or something like that, you do not need to report it. If there is a positive test, then you would need to report it to two entities, ODJFS through OCLQS. So you would go into the system just like you do an incident injury report to us. They have added a little section for positive COVID. So you would complete that, hit submit, it goes right to your licensing specialist. And then the second entity you have to contact is the health department. They are going to help guide you through what to do next. They really do a case by case. So don't be afraid to call them and thinking they're going to make you automatically close for 14 days because they don't usually do that. They help you maybe close a section of your building, or they guide you on how to sanitize and disinfect if there's an exposure. In extreme cases, they will ask that you close, and there's been a couple of those here in Franklin County that have had to close for 14 days. That would be if multiple people tested positive. We just had one where it was a floater whose child tested positive, and so they did, since that floater was all over the building, they did ask them to close for 14 days. If you are a PFCC contracted program, you can claim 21 pandemic days. So you'll get paid if you have to close for 14 days. You can get paid for those days. And in that document that I referred to, it tells you how to do that. It's only if the health department closes you down. If you choose to close down on your own, you wouldn't get the pandemic days paid. But if the health department recommends or requires you to close, then you can use those pandemic days.
And to find their health department, you could just Google like Franklin County Health Department. Or
if you're Franklin County, yep. There is a link, I think in that document that I just told you about, there's a link to how to find your local health department.
Perfect. I wanted to make sure we got that one at the end.
Yes. And you do want to inform your families, and there's a sample letter in the toolkit as well that you can use to inform your families that there was a positive test.
Great. Well, we are trying to be respectful of time. It's officially 1:30. I thank you so much for all your information. It was really, really helpful. I know I think we got to most of the questions in the chat, but if there was anything, we're going to scroll back through and make sure if we missed anything, we will update that with some answers for when we post it, if that's
definitely. Okay. Thank you so much. I want to just
really appreciate your time.
Yeah, everybody stay safe out there. I can't wait to see you again.
Thank you, Suzanne.
Bye.